can I ask the congregation to please stand? Buenas tardes, Sanibonane, Molo, Hallo, Tobela, Dumela, Lumela, Abusheni, Sanibona, Abuani, Salibonani, and hello. Good day. I'm now going to ask the presiding officer, who is the acting Vice Chancellor of Cuba, Professor Heidi Sosa Gonzalez, as presiding officer to constitute the assembly.
By virtue of the authority conferred on me, I constitute this assembly of a congregation of the Cuban universities.
Please remain standing for the singing of the national anthems.
Al combate coie meses che la patrios contempla curiosa, non temais una muerte gloriosa, che morir por la patria es vivir, en cadenas vivir es vivir, en afrenta y aprobios unido, del clarín escuchad el sonido, a las armas valientes correr. Gozi sigeleli Africa, malu paradisu pondolvayo, iswa imitanda zoyetu. Gozi sigelela China lo sapolvayo, murena buruka si chabastoye. Gesù, o felice in tuoli mazzuegnevo, o si voluche, si ciabasa, Gesù, si ciabasa, South Africa, South Africa. Eid im Blau van ons hemel, et in diete van ons ciel, bergtes van die kranse antwoord hier. Sounds the call to come together, and united we shall stand. Let us live and strive for freedom in South Africa, our land.
You may be seated. Welcome, esteemed Deputy Ministers of Health of South Africa and Cuba, members of the Diplomatic Corps, Health MECs, Acting Vice Chancellor of the University of Havana, Interim Vice Chancellor of UCT, heads of provincial departments of health, deans, distinguished guests, graduates, family members, and loved ones. Welcome to this historic occasion when we commemorate newly qualified graduates from the Doctor of Medicine in the Nelson Mandela Fidel Castro Medical Collaboration Programme. I am happy to announce that over the course of the two ceremonies, we are graduating 454 new doctors today. This brings the total number to over 3,000 medical graduates from this program since its inception in 1997. The procession was led by Marimba Jam. They are an award-winning social enterprise that both performs and teaches the African marimbas in South Africa. The band has over 10 years of experience performing at a variety of events, from big corporate functions to small, intimate gatherings. They've also had the honor of performing for the likes of President Cyril Ramaphosa, the Western Cape Government, the Springboks, the Desmond Tutu Peace Foundation, and many weddings. Thank you very much, Marimba Jam. We're now going to invite Chief Mackey, the descendant of the First Nations of this region and head of the Kusan House of Traditional Leaders, to undertake a short traditional thanksgiving for the graduates. Chief Mackey, please join us.
Ado, orere, let us pray. Tsui Kwab, the God of rain and thunder, be with us this beautiful celebratory day, where we celebrate the spirit of our youngsters, the achievers. We are grateful for your mercy, your kindness, your compassion shown. It's been a difficult journey for them, but you have been steadfast in your mercy. Therefore, we glorify, we venerate, we adorate, and we worship you. Aye. And our venerable ancestors, fathers, mothers, let us not forget them who showed us who is the great spirit creator. We call upon you. Remember, we are all sojourners on this journey. You've made a step in belief you didn't know about tomorrow. We caught in two realities, yesterday and today. Tomorrow is a promise, latent, but not a guarantee. Nevertheless, you've done it. So the sacred calling from us present here and the leaders, the teachers who have taught you, instilled in you a spirituality of teaching and learning, both from the Republic of South Africa and the Republic of Cuba. The spirits of people united, two lands. We are one. Do not strive for unity, oneness, the Great Spirit Creator. And remember, you are sacred, created spirit beings. The boundlessness of the spirit, the human spirit, is connected with the Great Spirit Creator. Therefore, all things are possible. Therefore, today is the first step into the world of service. Be worthy to serve. It's an honor. It's a privilege. And so too you will be rewarded by a smile, by a thanksgiving. This is what we plead to you today. This is our supplication to you, to never ever forget. Many people in your lives has assisted, has walked with you, has held your hands. Many tears were spilled. Nevertheless, in spite of that, you remain in this path, bringing a hope in a time of abandonment. It's not enough that we suffer from normal illness, but there is talk, there's a reality of war, which brings so much pain, anguish, suffering. You are the first that will experience these kinds of sufferings. May you be blessed. Ayesa, blessings upon you. Ayesa, never ever not be thankful to the Great Spirit Creator. And you never ever forget, you are sacred, created, spirit, human beings. Therefore, we honor your spirit first and foremost. Gangan, Chi, Abotse, Sidaitse, our Father, our Great Spirit Creator, magnificent in His mercy, His compassion towards all of us. Gangan, Chi, Ai. All I can say is this word, the sacred word. Atua tamakamski. Atua tamakamski. Let your spirit go before you, with you, in you, within you. And let you be led by your spirit, so that your work, fruitful indeed. And at night, when your head make peace with your pillow, a work well done, in honor of the sacred, created spirit human beings, that you are, that we are, all of us. Ayesa, Ayesa, Amase, Amase, Amasi, Amasi, Amase, Amase, Amasi, Amasi, is tantamount to Amen or Alleluia. In Kwekwe Govaba. Ay, Gangans.
Kai Sikai Gangans, Chief Mackey. Chief Mackey represents the communities that we serve as health professionals, as well as reminding us of the legacy of the First Nations and Indigenous knowledge systems at the foot of the Hurikwacho, which we commonly know as Table Mountain, the mountain in the sea, and the Place of Stars, which is where our health sciences faculty is based, Ikhamerodi Khais. So you are all stars today presented here. I'm going to now ask the Vice Chancellor, Interim Vice Chancellor of UCT, Emeritus Professor Daya Reddy, to welcome the congregation. Thank you.
Dr. Sibongiseni Dlomo, Deputy Minister of Health of the Republic of South Africa, Professor Fidel Mariana Reyes Obediente, Acting Deputy Minister of the Republic of Cuba, our Provincial Health MECs, Professor Heidi Soca Gonzalez, Acting Chancellor of the University of Havana, Cuba, and our presiding officer today, distinguished guests, colleagues, ladies and gentlemen, our graduates. On behalf of the University of Cape Town, it is my honor to welcome you all to this happy occasion when we commemorate and celebrate our newly qualified graduates in the Nelson Mandela Fidel Castro Medical Graduate Programme. I extend a warm welcome in particular to our colleagues and friends from the University of Havana, Cuba, and from Cuba generally. It is a privilege to have you here with us. En nombre de la Universidad de Ciudad del Cabo, tengo el honor de darles la bienvenida a todos ustedes a esta feliz ocasión, en la que conmemoramos y celebramos a nuestros recién graduados en el programa de graduados en medicina Nelson Mandela Fidel Castro. Doy una calurosa bienvenida en particular a nuestros colegas y amigas de Cuba. Es un privilegio tenerlos aquí con nosotros. Developing this program in cooperation with Cuba has provided a creative and collaborative way of growing the number of medical doctors in South Africa. It is a fine example of a wonderful partnership, of solidarity, of friendship, of support, for which we in South Africa are immensely grateful. Since the inception of the Nelson Mandela Fidel Castro Medical Graduate Programme in 1997, as we have heard, there have been more than 3,000 medical practitioners who went on subsequently to complete their studies at the various medical schools of South Africa. And of course today, this morning and this afternoon, we will be welcoming a further 450 new medical doctors. So this is really important, and one gains an appreciation of the magnitude of this contribution by considering the statistics. So according to the World Health Organization, South Africa has fewer than one medical doctor for every 1,000 people. And most of these practitioners are men. In the program, the Nelson Mandela Fidel Castro Medical Graduate Program, we've had a significant number of women. Through the years, today, 40% of our graduates are female. I take this opportunity to acknowledge all those, and here I'm referring to academic and support staff, family members, loved ones, those who've provided you with material and with moral support, and who've made it possible for you, our graduates, to achieve this great milestone in our lives. And today we must also acknowledge the efforts and contributions of the colleagues in Cuba's medical faculties who have played a central role in educating and training all of you, our new medical doctors. Reconocemos con agradecimiento los esfuerzos y contribuciones de las facultades de medicina en Cuba, que han jugado un papel central en la educación y prueba de todos ustedes, nuestros nuevos médicos. And of course, we celebrate each of you graduates for what you have accomplished, but also for what we believe you will do after you walk out of the ceremony and into your careers as practicing medical doctors. This is the end of the beginning. So I congratulate you warmly on the milestone that you've just reached, and on behalf of the University of Cape Town, I extend very best wishes for all the good that you will do after today and for the difference that you will make. Thank you very much. Muchas gracias.
Thank you to our Emeritus Professor Diaredi, Interim Vice-Chancellor of UCT. I now invite the Deputy Minister of Health, Dr. Simbongiseni Dlomo, to address the congregation.
Thank you very much, Program Director. Good afternoon to the Acting Chancellor of University of Havana, Professor Gonzalez, the representative of the Vice Minister of Health, of Public Health in Cuba, Dr. Fidel Mariana Obediente, and the whole delegation that is from Cuba. Our interim Vice-Chancellor of this university has just welcomed us, Professor Diaredi. My colleagues, MECs who are present here that I will recognize, but also want to introduce them to the parents and graduates so that they know them. There's an MEC of this province of health, Dr. Mbombo. May she just raise her hand? There's MEC of health in the province of Mpumalanga, MEC Manzini. There's MEC for health in the province of Northwest, MEC Sambata. There's an MEC for health in the province of Northern Cape, MEC Lekwene. Some of the MECs have apologized but have sent their representatives as heads of department who are part of us here. The Dean of the Health Science University of UCT, Professor Leon Green Thompson, and the entire leadership of this university that has provided us with this excellent venue and logistics. I also need to introduce to you and welcome, recognize the leadership of, for the graduates that you need to know, people who are in charge of your registration, the President of the Health Professions Council of South Africa, Professor Nema Tandane. If you go to the HPCSA office and you don't find him, you find the registrar, the driver of that HPCSA. He is also with us here, Dr. Mahome Masike. So all your problems, graduates, are sorted now, okay. Members of the UCT Senate present here and all the academic community, let me also recognize the members of the Academic Review Committee led by Professor Mtla from Sefako Makgato University and all the universities present here and represented, representatives of graduates and the graduates themselves, families, mndeni yonke nikhona lana nabangani, bonke abasihambele nemedia sanibonani. Kuhle ngesizulu ngoba muthe sanibonani nje ukhava ikuseni nentambama sebusuku. I must apologize on behalf of our minister who's not able to join us, Dr. Pahla, because of other commitments, and also welcome you into this august gathering congregated by the University of Havana under the leadership of Professor Gonzalez, who's an acting chancellor, to witness the awarding of these medical degrees. Let me also recognize in our presence the former health attaché of our program in Cuba, General Hadebe, who's with us here. General Hadebe, General Hadebe must have paid enough stipend. Let me now also recognize, sitting on my far right, the current health attaché, Dr. Nelson Mandela, up there in the audience. I would have failed if I don't recognize our foot soldiers in all the provinces who have been part of this program as coordinators. They are all seated here from national and also from the provinces. We thank these foot soldiers who have really made this program to be where it is. A week ago, I received the following message on my WhatsApp. Okay, by the way, I do have WhatsApp. It was written, and I quote, "I am leaving South Africa as we speak. Thank you for your unconditional support to my country, our cause, and to me personally. I grew and learned under your strong and dedicated leadership. I am proud for my 25 years of service in KwaZulu-Natal province," close quote. This was a very humbling message that came from Dr. Gustavo Lopez, who is amongst the very first group internationally who came to our country 25 years ago. He was going back to his country, having worked for that long in KwaZulu-Natal in what we used to call Stenga Hospital, now called General Gizenga Hospital. These doctors made themselves available in most of our rural hospitals in our country. These doctors contributed to the improvement maternal outcomes, the under 5 mortality improvement in our country. They have comprehensively contributed to maternal, newborn, child and adolescent health and well-being. They have been part of monitoring the antenatal visits when HIV-positive mothers who were pregnant came to our shores and were given in our clinics ARVs early in their pregnancies and gave birth to HIV-negative babies. Cuban people are loving people. But how did this come about? The contribution of the Cuban people during our period of our liberation is well documented. They fought with us. They fought for us at Quito Valley on the Angolan soil. President Fidel Castro once said, quote, "We came to Africa and did not take back silver or gold, but dead bodies of our soldiers who had been in the wars supporting and liberating Africa," close quote. At the dawn of our democracy, President Fidel Castro responded to President Nelson Mandela's request in rebuilding our health systems that Cuba would send to South Africa doctors from Cuba to work in our hospitals. President Fidel Castro also offered that they could train South African students to become doctors, and such program therefore started in 1997. With these graduates present here today, the number of students who have qualified from the Nelson Mandela Fidel Castro, as the program director has indicated, stands at 3,071 doctors. With just over 40 of them having specialized in various disciplines. As we meet here today, we always reflect on the visionaries of these two distinguished leaders who brought such a revolutionary in our country. Today we confirm that this relationship and partnership between South Africa and Cuba has yielded huge human capacity for the medical fraternity, particularly medical doctors. This is a remarkable milestone that cannot be hidden or forgotten, given the impact it has in South Africa. This is the legacy and the living testimony of the impact of this relationship between the two countries. The collaboration signifies the impact Cuba has had internationally in over 165 countries around the world. Also ourselves benefiting of social solidarity, excellent internationalism, and medical cooperation with Cuba through these doctors and specialists who have contributed so much. As I've indicated, Dr. Mandela and some of the senior, there are some of the doctors coming in from this program who are now occupying senior clinical management positions in various health institutions. I can count a few that I've noticed in this audience: Dr. Desmond from Northwest and Dr. Nhlakanipho from KwaZulu-Natal. We are grateful to all of you graduates that, notwithstanding the challenges that you faced being in a foreign country, you persevered. You left this program intact for those who will come after you, in the same way that those who came before you left the program intact for you to benefit from. This happened at the time when our universities in the country had limited intake of medical students for this program. We are happy to announce that there is a noticeable improvement amongst our universities to expand the intake of medical students. But Cuba, however, gave us another perspective in terms of training medical doctors. They exposed us to what we call is a desired approach in the world, that of primary health care, an approach that is embedded on community diagnosis, community orientation, and care, the approach that was once upon a time introduced into our shores in Polela by Dr. Signey and Emily Clark, and also supported by a report of Kluckman report, Dr. Kluckman report supporting universal health coverage for all citizens in any country, irrespective of whether they do or do not have money to pay for their services, which was focusing primarily on health promotion and disease prevention. This was long before the world came together on 1978 and talked about Alma Ata Declaration of Health for All in the year 2000. Needless to say, that year 2000 came and it is gone, but there is no health for all in the world. Our desire, therefore, in South Africa for this universal health coverage is informed by these processes. Our universal health coverage is also a champion, is also a program that is actually pushed in by the World Health Organization. So we are not right, we are not wrong to ask for this program and champion it in our shores. When you visit Cuba, it is very striking that you find a specialist surgeon working in a polyclinic. And when you ask them, but why are you in the polyclinic? And they have this as their answer. It is the cost-effective, preventative, and quality health care that we are pushing and providing to our citizens in working in the polyclinic. It reduces significantly theater times. It reduces the theater slates, because as a surgeon, I go in there and teach in a polyclinic how to prevent complications of diabetes and hypertension. I actually would have fewer and fewer patients coming into the big hospitals for amputations because they have got complications of diabetes. Now, that is something that we need to learn from. They are actually saying, among other things, they've eliminated a significant number of diseases in that country. I am one of those advocates to push for this program strongly, because prevention is better than cure. If we are not watching the space, the non-communicable diseases, which is cardiovascular diseases, chronic respiratory disease, cancers, diabetes, and mental illnesses are going to become a pandemic in this decade. And countries like Cuba, who are already on this program of primary health care, are going to escape this pandemic when all other countries are going to be engulfed with that. We are very much grateful to the programs and support, including that of Medical Brigade that came from Cuba, because not only did they support us in our own programs that we need, but they also came in very strongly to support us on our COVID-19 fight and the epidemic, and we are extremely grateful about that. As the program director has indicated, today we are here to confirm Cuban medical degrees to 454 of our medical doctors who have worked tirelessly day and night. Now, they are waiting for their names to be called while their bodies are shaking with disbelief. I've learned this from our Tsepotsulo in our country, to say, you really don't believe. You are saying, am I really a doctor? Yes, you are. Let me then take this opportunity to express our gratitude as a department nationally for all provinces that have supported us to drive this program in this program. We could have said this, but they were also the ones who are driving it in their various provinces. And they also would like to say, by supporting this program, you are very much determined to improve our health systems in our country, irrespective of whether our citizens can afford, because we are bringing the primary health care. These numbers that we are swelling today of these doctors is increasing our human resource capacity, and for that, we are extremely grateful because most of the doctors will go to the underserved, the rural areas, and actually support us there. We wish to actually congratulate you as you graduate and welcome you to this cadre of healthcare professionals in our country. We are also joining extremely dedicated healthcare workers in our country who have taken us to greater heights in this country, in our health system during COVID, and we are coming to support them there. I call you colleagues as doctors. As you take the Hippocratic Oath, colleagues, kindly note that this oath describes a promise that you make individually and collectively to try and not to harm patients and our people. This oath obligates you, is fungoless, obligates your efforts to protect individual rights and public interests. In your daily practice, you serve people who are dependent on you in the health system that we have. Please balance up the competing interests and values and draw your actions on ethical principles as tools for weighing conflicting claims and for reaching appropriate decisions. Your role is to save lives. I wish to express our gratitude to the families. Siyabonga kakhulu kubazali bonke ngokulekelela labantwana. Nibakhulekela, nibathwele, nixakekile bekude nani. Abanye bebuya sebenabakhwenyana. Abanye bebuya sebenaba nomakoti. Nina nani bathume ukuthi abayofunda. Kodwa nabekezela into enhle ekubuyeni nomkhwenyana nomakoti babuya ne-degree. Nako ke sikujabulela kakhulu. Lokhu komkhwenyana nomakoti sekuyibonus. Kodwa into akade beyihambele ye-degree bayiphethe. Today we celebrate your achievement and welcome you back into our country, into our health fraternity system, to apply the knowledge that you acquired and contribute in the building of our sustainable health system in South Africa. There are many who still ask the question, why should it be Cuba training us, training our citizens? Now we are saying we want to continue because we are glued to their primary care approach that they are also doing, and maybe slowly we'll move from our hospital-centric focus as South Africans, which is actually what the National Health Bill is expecting us to do. I hope, therefore, that you're coming back and your background that you got from Cuba is going to contribute greatly in the implementation of the universal health coverage, which you have learned, grounded in Cuba, and ensure that people of South Africa enjoy the health dividends of our democracy, irrespective of whether they have a deep pocket or not. This government of South Africa wishes to again appreciate the partners in this program, particularly the government of Cuba, all our universities in our country. We have supported our students as they complete their final year, all our government, all our provincial departments, and in particular, for this graduation, we want to thank the University of Cape Town that has provided this venue, and also in particular, Professor Green Thompson, the Dean of the Faculty, have been championing with his own team, whole team, that has actually supported us with logistics. We congratulate you, Bantabam. We would like to encourage you that before you go out into the world, where you are already, start at home. Nihambe niyobhidliza lezi zindlu zasekhaya ezakhiwe ngamasoyi nodaka nibakhele izindlu zama-blocks. That you go home, because this is only Zulu, you go home and start in the house and demolish those mud houses and build the families, your families, blocks, houses of bricks. made of bricks. And we are very grateful that all the siblings who are coming after you are not going to depend on NSFAS anymore, because you are there to support us. When you build those homes with bricks, please don't forget to put them and give them solar system, please. We are actually asking you to go back home and break the chain of poverty that is existing in your own home. The world will respect you when it sees you as a doctor, to start by caring for that mother that you left 6 years ago, who had nothing but now has you, to build a better house for them. Please be the instruments of improving the quality of life in our country, but starts at home by breaking the chain of poverty in your families. Please go out there and assist your village, assist your community, assist our country. Do it for President Nelson Mandela. Do it for President Fidel Castro. Thank you very much.
Thank you very much, Dr. Simbongiseni Dlomo, our Deputy Minister of Health of South Africa. We thank you. We are delighted now. In fact, before that, I must apologize. We have a quick announcement of a child, of 2 children who are unsupervised and might be lost. Mashodi is the child's name. If there are guardians in the room, please could they come and collect them in the maths building, where the staff, UCT staff, are taking care of them at the moment. All right. We're now going to announce a musical item, and we're delighted to welcome Kanyiseli Dyanti and Sipe Kwani, who are going to perform for us today.
Bella cosa da giornate sole, l'aria tempesta dopo una tempesta, per l'aria fresca pareggia una festa. Che bella cosa una giornata sole, mannato sole, più bello in me, oh sole mio, sta in fronte a te, oh sole mio, sta in fronte a te, sta in fronte a te. Quando fa notte, o sole se ne, me vede quasi una malinconia. Quando fa notte, toia restaria. Quando fa notte, o sole se ne scene, mannato sole, più bello in me, oh sole mio, sta in fronte a te,
vibrant South African College of Music is a jewel in the crown of the University of Cape Town and at the forefront of music making in South Africa and internationally. And we really would just like to thank our three musicians. Dale, if you can stand as well. Kanyiseli Dianti is a young tenor who recently graduated from UCT and is currently studying towards his postgraduate diploma. And Kanyiseli has performed on stages such as Starlight Classics. He's sung in a masterclass with the head of the opera program at the Guildhall, Dominic Wheeler, and is set to make his opera debut at Opera UCT, singing the role of Nathaniel in September in the Baxter Theatre. Congratulations. Sipe Kwani is a young baritone singer born and raised in Khayelitsha, Cape Town. He holds a postgraduate diploma in music performance at the University of Cape Town Opera School, was introduced to choral music at high school, and won his first place in the Western Cape Choral Music Association Solo Development Competition. He has performed in various chorus roles in collaboration with Cape Town Opera and the South Africa Collage of Music Opera Kaleidoscope. He's won numerous prizes, both audience and competitive prizes, and we are delighted that as we stand here today in the Sarah Bartman Hall, that in 2022 he performed the role of Alexander Dunlop in the new opera of Sarah Bartman, written by the South African composer Hendrik Hofmeyer. Thank you very much, Sipe Kwani. The prelude music and the national anthems were accompanied on the organ by organist Dale van der Went. Dale has completed his undergraduate studies in organ performance at the South African College of Music and is currently pursuing a postgraduate diploma in the same field. He serves as the director of music at St. Mary's Cathedral, where he conducts the cathedral choir and regularly performs on organ. He's a member of the Cape Town Baroque Orchestra, where he plays organ and harpsichord, and has participated in performances such as the St. John Passion by Bach. Thank you so much, Dale. Thank you, colleagues.
Phina madoda kwakhe kwanje phina mawethu lapho inyanga lomzantsi Afrika madoda yaswabuluka inamba kwavele kukhanya sangqunqa sangqumshela ngoba kaloku sinemincili nemivuyo ngoba nina babambethi ingubo ezinabalabala kutheni nezingubo zangasile imibala embetshembetshe ewe kaloku bathwaliseni imiqhele bavumelene noyongoni bathwalisa isithaba kaloku bagqibile bangxangile bangxamile ningabalibazisi kaloku ngoba bagqibile umsebenzi bebewenza hayi makwethi nihlekane lokugqibela hlekani isichazo lokuvela nelokugqibela ngoba le ntwana usathane idanile hambani maqhawe nani maqhawekazi niye kwelo lizwe ngoba lelenu kakade go and heal our land ewe onelezelanga bayatsho bathi an early bird catches the fattest worm. Rise, you generation of wisdom, rise. Rise, you generation of wisdom, rise. Fly, you eagles, fly. You have conquered in all odds. Today we say congratulations to you, people of great honor. Sibamba ngazo zozibini kuni. Ngoba nizinhlezane eziyazabancelisa kulo mabele abhonxileyo. Sithina ngamso mazenethole. Nakuni baxhasi bemfundo yabo. Sithi nxe sunele zonyembezi zeqhala kaloku. Nilila zovuyo. Ngoba umsebenzi buqali ugqityezelwe. Hlekani nivele nolokugqibela. Ngoba kaloku nithi themba mqala uzawuginya. Amade ngawetyala makwethini. Esithela umagaba ucihosha umuntu omlambo uthi thiba umsuthu umjobi. Esithi yeha yo. Hala.
Enkosi kakhulu, our Mbongi, Nelson Mandela. An Mbongi is a composer and orator of poems of praise. Mbongi offer critical commentary and narrative on the state of society through the Izibongo. The poem of praise, an Umbongo, was offered in honor of the graduates, their families, and their teachers. Nelson Mandela is a UCT graduate with a degree in music education and honors in curriculum studies. She is a vocal artist and musician with 4 albums. She has traveled internationally with her music, with her own band, and with the Barnyard Theatre. She writes and recites her own poems as an Mbongi. She praises in various ceremonies such as weddings, graduations, and of course today. A sincere thank you to Nelson Mandela for her poem of praise for the graduates. Enkosi kakhulu sis. I'm now going to invite the Deputy Dean of Social Accountability and Health Systems, Associate Professor Tracy Naledi, to lead the graduates in pledging their declaration of oath now.
Can I request the graduates to please stand? Can I request health workers to please stand? Can I request Chief Maki to please join us to receive the oath? Can I ask the graduates to please take a moment? I would like you to look around the room. I would like you to look at your family, to look at your friends, to look at your teachers. I want you to look at your community. I'd like you, thank you colleagues, thank you. Can I ask the parents and the family and friends to please sit down? Thank you. Graduates, you are about to take an oath. This oath that you are taking is a solemn oath. It's an oath that you will see that even us as health workers are standing and repeating the oath because it bears remembering. It's a promise that you are making. It's a promise that also you are remembering. By having Chief Maki here in front of us, we want you to remember past injustices that have been suffered by people in the hands of people like you and me, in the hands of other health professionals. We want you to remember great injustices that were suffered while people like you and me watched and did nothing. Today, you are making this oath, and you are saying in front of your family, your friends, your community, your teachers, you are asking them to hold you accountable. I would like you to please follow me. I will lead you in the oath. I will use my name, but you use your name. Zikhulumeleni. Don't talk on my behalf. Okay. Are we ready? I, Tracy Naledi, solemnly swear, pledge to serve humanity. My most important considerations will be the health of patients, the health of their communities, and the health of the environment.
My most important considerations will be the health of patients, the health of their communities, and the health of the environment.
I will not permit considerations of age, gender, race, religion, ethnic origin, sexual orientation, disease, disability, or any other factor to adversely affect the care I give to patients. I will uphold human rights and civil liberties to advance health even under threat. I will engage patients and colleagues as partners in healthcare. I will practice my profession with conscience and dignity. I will respect the confidentiality of patients, present or past, living or deceased. I will value research and will be guided in its conduct by the highest ethical standards. I commit myself to lifelong learning. I make these promises solemnly, freely, and upon my honor. Welcome to the profession, colleagues. Guys, Gandans, Chief Maki, please have a seat.
Well done, colleagues. We now start the formal part of the proceedings, where the degrees will be conferred. And so I invite the Acting Vice Chancellor of Cuba, Professor Heidi Soca Gonzalez, to confer the degrees.
Okay. I admit to the degrees Doctor of Medicine to the candidates recorded as in annexation. I shall admit to the degrees Doctor of Medicine to candidates presented to me.
Thank you very much, Acting Vice Chancellor. Sithi halala amadoda lamashe halala. Njengabo namhlanje isikhathi sokujabula ukuthi sithi inkosi. Simele kancane ukuthi sikhumbule labo balahlekelwe endleleni. And so at this time, I ask the congregation to honor those students who started out in this group of students and have not been able to finish because they have died along the way. From Gauteng province, Pomolo Maiti Mahika. From Mpumalanga, Mtunzi Wiseman Zwane. And from the Northwest Province, Kiabetswe Rakomo. I ask the community just to hold a moment's silence to remember them and to remember their families for whom this would have been too a celebration. I'm going to ask thank you, colleagues. I'm going to ask the graduates that as they come up, please stand next to me looking out at your communities and then move quickly to the registrar who will cap you. You may come. Stand here and look out. Sean Kamogelo Mpubane. Nompumelelo Sophie Skosana. Peter Sibusiso Sposake Chabalala. Sibusiso Mgomezulu. Tolofelo Matea. Tamsanka Emmanuel Ngobo. Itumuleng Molotsi. Vusi Innocent Shabangu. Guguletu Octavia Nduli. Can I just say to the candidates, you're to kneel in front of the Vice-Chancellor. That's not a chair for sitting. Joseph Lehonolo Molupe. Chireletso, face the community. Chireletso Sechopolo. Masejo Paul Mashatila. Makatikela Precious Mochana. Minenhle Senamile Ngumalo. Colleagues are not getting this right, right? Ompa Mulaudzi. Gladys Mahotso Rankota. From SMU. What did you do to SMU? Sorry? Fulufelo Sadiki. Innocentia Mbali Shabangu. Success, progress, Sanjana. Teboho Elvina Pasha. Tabo John Mohatle. Nomtandazo Yolanda Siwele. Nolita Winky Sibia. Remember to kneel when you get there. Mahlatse Reineth Shongwane. Dumisani Banda. Masemola Patience Silamela. All the way. Mtembi Mapekwa Confidence Mateme. Tendo Mufadi. You can go. Keep going. Tebogo Dinalane Ramaseja. Tabisile Leti Ntuli. Letlogonolo Quentin Tsatsi. Kneel on the kneeler. Guy, kneel. Just kneel. Tsepiso Elvis Rakanang. Remember to kneel. Katlejo Mpatsake Tutsi. Mbali Khatebe. Tato Leon Seseni. Congratulations. Is this Motus? Motus Snenkosi Nkomo. Go. Face the community. Tabang Motsie Lua. Holane Lesterina Mabota. Ayanda Lynette Prinsloo. Gift Peter Motene. Are you going to get the kneeling right? Vincent Tadishi Manala, an edited version, Dr. Live Machaela Pasha. Go. Lavella Blessing Samantha Makalima. Emmanuel Trust Ngomana. Pamela Lerato Nyandeni. Siamukelwa Mohlwayo. Lesego Pakwet. Esther Ntsonda. Turn around and face. Yeah. Mafana Katlego Moshala. Manhuako Surprise Modiche. Ndivuo Mpepu. Lwazi Yonzi. Kwandiwe Kabiso Ndlazi. Bandile Nokwetu. Tabang Joseph Monama. Ratsipa Zeblon Molefe. Lucia Lebogang Gafele Pilane. Zitembiso Siabonga, praise God, Ngubane. Tapelo Madonsela. Odwa Christopher Mpaka. Ramothwalo. Lesedi Ramothwalo. Onika Nwamashila Hlale. Teresia Tindisa. Kiamogetse Sylvia Wetrimang. Congratulations. Rebecca Tumiso Senwamadi. Hi. Turn and face the people. Oratile Rorisang Suakane. No? Stand here. Face the people. Sicelo Brilliant Ngomane. Lesedi Prudence Klame. Mvuyisi May. Nelisiwe Tabile Tricia Nzimande. Bavuyise Mabinja. Congratulations. Tebogo Maseko. Zonique Suan Willemse. Mponcheng Gwendoline Nobula. Motlalepule Motsamai. Kihomoditswe Doris Smile. Mabato Brilliant Angelina Motiba. Congratulations. Lerato Sarah Mokwena. Hope Lucretia Nguma. Tabiseng Loli Tsebe. Lucas Tabiso Sepolwane. Sbusiso Blessing Ngobo. Gladys Puseletso Sesinye. Priscilla Smith. Isaac Mashilo. Sibongo Musa Martin Metula. Bennett Raopala. Tabang Mapeto. Sibusiso Savi Nkosi. Savi. Sikethelo Nokwanda Nkosi. Me too. Sinenhlanhla Fanele Hope Ngobo. Konanani Randima. Muelelwa Nechipisa. Bishop Amos Malunga. Lubabalo Advocate Moshekile. Karabo Prince Shakwane. Sibusiso Tinumuzi Sibeko. Zelda Mulaudzi. Leonie Clarice Trantal. Congratulations. Mangoba Comfort Njangamanja. Tabang Monakedi Morwane. Letabo Peter Mokoma. Stand and face the audience. Dr. Thabo George Moss. Kagisho Bruce Makanyana. Talifani Pizza. Fumani Peri-White Nkuna. Riatile Shadrach Mchuma. Mama Shia Maria Masangu. Go all the way. Lerato Ramusedi. Asanda Ndawombini Matende. Bongiwe Ayanda Nchangase. Maredi Leshabile Siraka. All the way. Ignatius Mpo Pasha. Sipogazi Nokemane. Vuyelwa Pearl Ntushelo. Andiswa Tsotso. Kekeletso Pindile Mosia. Congratulations. Edwin Tebogo Ramolope. Stand here and count. Moshako Charles Pasha. Oratile Ikalafeng. Hangumso. Just face Onele Pangomsu. If you go all the way. Jennifer Ngwenya. Masimola Melvin Chepang. Mpo Olga Mauna Tlala. Pishego Desire Pelusa. Go. Bongiwe Penny. Aphendule Siekaya Mhlanga. Kabelo Siwela. Go all the way. Umvelo Wiseman Tango. Face the crowd. Face the crowd. Mondli Cyprian Nzuza. Lebogang Tangane Mapeba. Kebile Lynette Ngema. Mosimane Khape Vincent Poko. Kemisetso Darius Sioketswa. Temba Gerald Masuku. Congratulations. Sibusiso Sandile Hamilton Skosana. Melican Madua. Mulalo Nechiunda. Look at the community. Samkelo Percival Shange. Brendan Fries. Malosi Gift Ramahuta. Nonhlakanipho Wendy Shongwe. Such concentration. Swaratle. Khomotso Swaratle. Sechedi Johannes Charlie. Sikati Gilbert Ranglwa. Caroline Zetu Ngubane. Solanang Washington Mohubu. I want to make this point here that this is a student who has passed through the WITS program cum laude, Tabelo Ramulongo. We'll give her a moment. I'm saying we'll give her a moment. Batolile Marcus Mokari. Off you go. What is the meaning of this? Is this a new time? This is a new time. Okay. Nice. Nice. It looks nice. Karabo Fortune Motsuena. So to those who are coming, if there's anything special about your achievements, write them. Only academic though. I don't want the other ones. Rolindela Pernell Nolukalo. Matinandile Ngwengweni. Zbonelo Knowledge Malunga. Elliot Kwena Sitati. Tsepo Madisha. When I want to give them, then they don't want to take it.
I'm a comrade.
Comrade. Don't give me comrades here. Mojalefa Maile Moloi. Kanyisile Ntebele. Mita Zungu. Sandy Shamulo Yingwani. Nzama. You reckon you don't have pronunciation? Tapelo Nzama. Malebo Weni Mohotu. Mamoniele Francina Moreme. Katlejo McDonald Mononyane. Mohau Enedale Nkuna. Nsamai Lydia Molebatsi. Sechia bin Mapotoma. Advisor Ntobeng Mashabela. Congratulations. Reginald Tabang Moshaba. Sehopoche Karabo Mokhaladi. Bonke Mweketsi. Tobegile Mtetwa. Letabo Prudence Selolo. Congratulations. Martina Teboho Moshala. Tumiso Maruping Mohoto. Ongopotse Kiarebilwe Nkata. Prizel. Lifa Prizel Zita. Tembega Samukelisiwe Mtembu. Malusi Simon Muichela. Dr. Lindo Kuhle, Faith Nyumbega. Chiamo Gail Martha Mtembu. Congratulations. Osego Jessica Mohutu. Christopher Danielle O'Brien. Modise Hendrik Setsese. Tabang Christian Patela. Congratulations. Tibatso Stephen Seretlo. Tato Vincent Molo. Kialebocha William Siolwane. Tapelo Ishmael Mokati. Congratulations. Siphelele Eric Sibisi. Okay. Honest Morake Murudu. Motraiwa. Lekonolo Gavin Motraiwa. The end. Franz Tabo Mashope. Dominique Mononi. Fano Trust Munya. Lerato Juliet Sepato. You are so small. Solofelo Mosetsana Gape Ndlovu. Siposetu Ngwevela. You can only concentrate on the stairs one at a time. Matsiane Miki Maleka. Nompumelelo Angela Masangu. Vuyiswa Krista Mavunja. Lindo kuhle memela. Sibusiso Mieza. Haufengwe. Motusiotsile. Mokgori. Haufengwe Motusiotsile Mokgori. Kialibocha Felicia Machano. Manda Mudao. Masedi Franz Marakalala. Letwaba James Sefufula. Neo Floya Maseko. Lesedi Whitney Mosetle. Selika Ranjit. Bentley Bongani Nkuta. Kiorapetse Vincent Monyuku. Nyiko Ngomana. Samkelo Simelane. Welcome, Zulu. Gift Moripa. Tsepo Tabanyane. Tsepang McDonald Nkwe. Khoitse Mudimo Gift Pizza. Lesejo Mokutu. Muimeleli Ndo. Gundo Masindi. Lebitsi Matthews Rapotle. Non-Dumiso Ndlovu. Pindile Carol Ngube. Ompile Michael Senokwane. Come. Lebogang Nelly Kristen Mashile. Mpo Sehanso. Zanele Sophie Marilela. And in the words of the first peoples of this area, Kaisikai Kangans, Inkosi kakhulu.
Let's give all the graduates a warm round of applause. I would now like to invite the class representative, Dr. Gladys Sesinye, to come and to make her address. Thank you.
Good afternoon, everyone. Hello. I'd like to greet everyone who's here. Start with the ministers, the MECs. Start with the university representatives, and everyone who's here, the families and everyone. But mostly, I'd like to greet these people who are here. Guys, we made it. It is not easy. It is not easy, but we are here. And today we are just putting a stamp on it and saying, yes, we are doctors. I'd like to thank the government of South Africa for giving us this opportunity. I, for one, was rejected in a university for medicine, but look at me now. I was given this opportunity and I grabbed it with both hands. And I'd like to thank Nelson Mandela and the government of South Africa. Thank you very much. Y el gobierno de Cuba, gracias a ustedes por abrir de puertas de su país para nosotros, para enseñarnos nada más de medicina, además de medicina, pero el cariño y la humildad. Because in Cuba, we did not only learn medicine, but we learned to be human. We learned to respect another person the way we respect ourselves. Gracias por la oportunidad, Cuba. And I just want to thank my colleagues for not letting go, because we know there were people who failed in this journey, but we held on. And we are not only doctors, but somos médicos de ciencia y conciencia, médicos de bata blanca. And with that said, we are not just ordinary doctors, but we are doctors with humanity. And we are not doctors because of science, but we are doctors of science and consciousness and love. Guys, as we leave here, and in conclusion, as we leave here, let us all remember what we were taught in Cuba. In Cuba, we used to share buses with the rest of the population, and that is humanity. Let us not forget, guys, what we were taught. We were taught to be patient with patients, and we were taught to prevent illness and not to prevent and to cure. So let us not be swallowed. Let us remember that to prevent, we have to teach our patients, and we have to be patient with them. I'd like to thank all the parents for the patience and for the love that you've given us throughout the 7 years. You guys are amazing. You've given birth to legends. See those people sitting there? Those are legends. And in conclusion, guys, I'd like us, all of us, to give ourselves a standing ovation and say, we did it. Somos médicos de ciencia y conciencia, médicos de bata blanca. Thank you.
Colleagues, while you are standing, we've remembered that you owe your thanks to your teachers, but especially to your families. Raise your certificates in salute, point to your families on that side and behind. Thank you, colleagues. I now invite the Acting Deputy Minister of Cuba, Professor Fidel Mariana Reyes Obediente, to address the congregation with a concluding message.
Créanme que por la mañana hice unas pequeñas palabras en inglés para todos ustedes, ¿verdad? Pero creo que el momento es propicio para, por esta vez, hablarnos en español. No sabemos cuándo volvamos a encontrarnos. Es muy difícil calificar este día. Este día es el más importante para ustedes, ¿verdad? En este día se cumplen todos sus sueños. Detrás quedan los malos momentos, porque en Cuba tuvieron que aprender muchas cosas, pero también tuvieron que pasar muchas cosas, ¿verdad? que al final los llevó hacia un camino, el objetivo final que era ser médicos. Para nosotros también este día es muy importante, porque verlos a ustedes allí, representando cada uno a sus provincias, viendo el sacrificio de todos sus padres aquí, la alegría desmedida de todos sus familiares, nos llena a nosotros de orgullo porque es el resultado de lo que las universidades cubanas, de los que Cuba hizo por Sudáfrica. Ustedes son Sudáfrica, ¿verdad? Entonces, en este día yo quiero hacerlos partícipes de un mensaje que nos llegó de uno de ustedes. No vamos a decir el nombre, porque pienso que lo que está escrito aquí habla por todos ustedes. Buenas, profe. Solo quería decirle gracias a usted, a todos los profes y a Cuba. Mañana, hoy, será un día especial para nosotros y esto fue un sueño casi imposible. Pero ahora soy médica, como decía Fidel, luchar contra lo imposible y vencer. Muchas gracias, profe. Muchas gracias a ustedes y éxito en el futuro.
Muchas gracias, Professor Fidel Mariana Reyes Obediente. I would now like to ask the MEC for the Western Cape, Dr. Norma French and Bombo, to give a word of thanks.
So you can say that. Isicalos ka Dr. Sio, yeah. Wenukalelani, wenukalelani. Thank you. Wenukalelani, wenukalelani. Isicalos ka Gqirha Sio, yeah. Wenukalelani, wenukalelani, sizawuthi izinto wenukalelani, wenukalelani. Thank you, thank you, thank you, thank you, thank you. Okay, just for a simple translation, it's about, for those who don't understand the song, it's about things are going to change. So don't cry, things are going to change. So we added some of the lyrics, changes that the cries of the doctors, you need to listen to them. So that's what we're trying to say, things are going to change. So having said that, on behalf of my colleagues as a provincial MEC, provincial minister, MEC for health, on behalf of my colleagues, as you know that in South Africa, health is a concurrent function of the national and the province. National Department of Health, they don't own hospitals, they don't own patients, they don't own any health facilities and the HR. The provinces are responsible for such. So the National Department of Health has done their job. Thank you, Deputy Minister and Minister in absentia, and everyone from the National Department for doing what you have done, for making sure that South African students could be able to be exposed to such, specifically primary health care. Thank you. Now, as provinces, we have a responsibility that we provide the tools of trade. So when we send you, whom shall we send? We are sending you. And we are sending you to us, to the provinces, as part of the health professionals, knowing that things are not as good, things are not as well. It means that we have to dollar whatever you must in some other circumstances. But what we promise you is about, you'll be part of the other health workers, be part of the team. Patients are your partners, co-partners. Your other colleagues are your co-partners. But noting that there are still challenges of social determinants of health, which we expect you to work as part of the whole of the society. But you have achieved, you have done, you are here now. Besides the challenges that you have to in between two countries, and also between two universities, but you came up with something, the primary health care, which Dr. Dlomo was trying to take it back in South Africa during the times of the Pongola. So you have to stand up and clap for your successes. Stand up. You did it. Thank you. Thank you very much. It's Carlos Kagrecha, to the parents, I'm sure now at least now things are much better. Sending your kid, whether you are from one province to the other, from within the same province, from one town to another, you always feel like, oh, so at least babuyile abantwana. And therefore, zonke ezanyembezi benizikhalela kugcwala amabhakethi, imithandazo yenu iviwe ngoku. Imithandazo eshotayo ngoku into yoba mabathi when they are done with the internship, at least we could be able to absorb them for ComServe and also they get a job. Bangahlali pha kuba singenanto because kaloku into it's about the money. So you need to thank yourself for doing what you have done. Qwabeleni. And then, last but not least, to Cuba. They keep on teaching me, it's not Cuba, it's Cuba. So thank you very much for participating in all of this. And I was so proud when one of the doctors was speaking on behalf of the others. It was just the language like that. I was like watching Bill Cosby show. There was the lady there who was speaking Spanish. And then I've just taken a decision that I must learn Spanish as well. But thank you very much for doing what you have done. To the Ministry of Health from Cuba and also University of Havana, thank you very much for what you have been doing. And then lastly for the UCT, starting from higher up, the interim Vice Chancellor, the Deans of Health Sciences and the Deputy Deans, and every academic that is here, but most importantly, the people who have made sure to organize all of this. The background, whilst we were sitting there, some of the others were saying that this is a complete different scenario because universities have been rotating to host these graduations. But the UCT one is different. I said, of course it's different. This is Western Cape, but thank you very much. I'm breaking. Thank you.
Enkosi kakhulu, MEC. So we're coming now to the end. This is a wonderful, thank you colleagues, this is a wonderful celebration that we have spent the last 2 hours celebrating together. It is the time when the conclusion of your careers, and thanking your academics, your professional staff, your parents, your sponsors as provinces, your loved ones, those here locally in South Africa, the universities, as well as those in Cuba. And we all are here to honor all the hard work that you've put in over the last number of years. And so we sit here today and charge you with the responsibility now of leaving here and unleashing your abilities and capabilities to be able to send you out, as the MEC has indicated, into a world that desperately needs your kind of service and leadership. We are entrusting our future to you, and we are proud to do so. Hearty congratulations on the milestone that you've just reached today, and all the best wishes for internship and community service going forward. Congratulations again. As we draw this to a close, shortly I will ask the presiding officer to dissolve the congregation, which forms the official closure of the ceremony. But before that, just a few announcements. We are going to ask the congregation to stand and to please remain standing until the procession has exited. We ask our new colleagues, graduates, to join the end of the procession and proceed out with us. So as soon as the platform party proceeds past you, the ushers will direct you to join us. We ask that you exit, we'll exit out of the side door and under cover to protect us from the rain. We ask all the graduates to please join us under the cover on the platform so that those of us around can greet you and meet with you, including the Deputy Minister who would like to see you afterwards. And a photo shoot, says the Deputy Minister. Those who have not been able to collect their certificates yet, to please come to the Maths building after the ceremony, and we will make sure that, that you can collect your certificates there. Those of you who did not have lunch before the ceremony, please collect your food in the Leslie building. So as you descend down the stairs to your right and a few buildings along, there will be ushers to direct you to collect your lunch. That concludes all of the announcements. I now ask the presiding officer to dissolve the congregation. Thank you very much.
By virtue of the authority conferred upon me, I hereby dissolve this congregation of the Cuban University.